Welcome to Money Curve. With me today is Anita Zaidi. She is the president of the Gender Equality Division at Bill and Melinda Gates Foundation. So what's new is that the foundation is committing $2.5 billion through 2030 to transform women's health globally. Hi Anita, so good to have you with me today. So this 2.5 billion globally, how does that translate for Pakistan?
Pakistan has an outsized burden of diseases in women and children. So, Fatma, I'll go back to when I used to practice at Khan University, and I would see children come in with their health problems, with malnutrition, and I would be telling the mother that, you need to breastfeed her properly, you need to take care of your infant. But then I would look at the mother and I would say, oh my God, her own health is so poor. Who is looking after her health? Why is her health not important? And also that a lot of the problems that we were seeing in the babies were actually problems in the mother's health, right? And that without addressing mother's health, it was not possible to address children's health. And this is the reason that newborn mortality, for example, in Pakistan, where 1 out of 25 babies dies in the first month of life, it's the highest in the world. And that is because of the neglect of women's health. And so from the Gates Foundation perspective, we have been working in Pakistan for a long time. Many of these innovations are also locally informed by research that is done locally with our partners and many civil society organizations and academic institutions. We work very closely with the Khan University. We work very closely with LUMS, especially on the AI side now increasingly. How do we bring AI to women's health so that women can get the care that they need? Malnutrition is a very big area of work, malnutrition research and gut health research. So what are the ways in which we can improve gut health of pregnant women, because that is very deeply connected to malnutrition that we see. So it's a lack of food and appropriate calories and vitamins, but it's also a very living in an environment in which they are exposed to a lot of infections that make the gut very inflamed, and that causes poor pregnancy health and poor baby health.
My challenge to this is that yes, we need R&D and all that, but we also need a cultural reset. Women's lives don't matter in Pakistan. We have this video circulating of that honor killing in Balochistan, and that is socially acceptable. Honor killing in many parts of the country is socially acceptable. So in a country where women's life is valued so less, how can Bill and Gates Foundation step in and bring that change? Because it's not just about money; it's about changing mindsets.
Yes. So, Fatma, it's a very important. So, Pakistan has one of the poorest indicators on gender. As you know, we are like at the bottom of the list. There is no denying that. And that is the systematic neglect of women, whether it's health or other areas. And I actually, I lead the Gender Equality Division at the Gates Foundation. So, we look at many of these issues very broadly. And in Pakistan, for example, we are doing quite a bit of work through economic empowerment, the financial inclusion, then supporting, women's nutrition, supporting access to contraception. So in many different ways, but ultimately it's up to Pakistanis. It's up to Pakistanis to change the reality that women face. And that is up to civil society, to government, to good policy making, to change the reality of women. And without recognizing that women should be at the heart of development agenda, Pakistan will not prosper. Pakistan will not prosper without recognizing that women's development has to be central to the country's development.
So if you had to choose one area of women development or women health in Pakistan, one area that you would begin with, what would that one area be?
Yeah, so it would be, I would choose pregnancy health, because it is tied up to so many other things. If you get pregnant when you're in poor health, you will continue to remain in poor health during your pregnancy. You will deliver a baby that is not healthy, and it's a transgenerational issue. And so focusing on pregnancy actually is focusing on women's health as well as children's health. So I would choose that. That should be the highest priority. The 5 areas of work that we've actually chosen are broadly the diseases that are the most prevalent and cause the most disability and are the most neglected for R&D. And just to make it clear for our viewers and readers, that this commitment is for the R&D part of women's health. But we work much more broadly in sort of health system support, primary health care, getting innovations delivered to people. Immunizations is a very big focus, and so in this year, one of the things that I'm really proud of in Pakistan is going to be the introduction of the HPV vaccine. Okay, the human papilloma virus vaccine, which is the virus that causes cervical cancer. It's one of the most common gynecological cancers, and Pakistan is going to introduce that vaccine. It's 1 dose to girls to prevent cervical cancer forever. And we funded the work from Pakistan, from the Gates Foundation, to show that 1 dose of this vaccine is enough to prevent cervical cancer. And now Pakistan, which did not want to introduce the vaccine when it was 2 or 3 doses, now wants to introduce the vaccine because 1 dose will get rid of this problem forever.
So has this program been rolled out?
It's going to be rolled out in September in Pakistan.
Wow. And this is for all mothers, all children?
So this vaccine is to be given to girls. It's to girls 9 to 11 years old. Eventually, it could even be given to older girls. First, we have to get the vaccine out to the primary group that can be prevented. And
is this part of the 2.5 billion initiative?
No, so this is not part of the 2.5 billion. Yes, so this is what I'm saying. This 2.5 is new innovation and new research. But this work actually I led previously at the foundation that has now become so mature that the countries are introducing it, and Pakistan is going to be the latest country to introduce this innovation.
That is brilliant news. So this would be given at hospitals, or this would be like the polio vaccine?
It can be given just like any regular vaccine. It can be given in schools or in outreach campaigns to people's houses or in clinics with people bring their daughters for vaccination. All of those.
And that 1 dose will prevent cervical cancer for life.
For life, yes.
Wow. Yeah. That is so many lives saved. That's such brilliant news.
So globally, cervical cancer causes 300,000 deaths every year. Okay, and in Pakistan we don't have the screening available for cervical cancer. So prevention is the best tool. Screening is rare. I mean, it's only educated women get screened. Most women don't get screened.
I didn't know there was a screening for it, and I'm an educated woman.
Yes. So Fatima, one thing, I will be in Pakistan shortly, so we can do an in-person if you
want definitely.
Later on.
Thank you so much for the conversation, Anita, and I really hope to have a longer conversation with you sometime in the future. From what I understand, women in Pakistan, even compared to low-income peer countries, are among the worst treated in the world. And with the resources dedicated, it is Pakistan's problem. It is Pakistan's problem to solve, and it is Pakistan's problem to empower women, to educate women, and most importantly, take care of their health so that they can be contributing members to the Pakistan economy.